Hello and welcome. My name is Melissa Montano and my pronouns are she, her, and ella. I am a certified peer worker and I'm with the program. I am the program manager for the Office of Peer Recovery and Engagement for the state of New Mexico. I'm so honored to be your host today for this panel entitled Punitive Justice and Community Health. I want to thank our wonderful moderator and panelists for being here with us today. And a big thanks to all of you for joining us. We are truly grateful and we hope that you find today's presentation engaging and helpful in the work that you do in your communities. This presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Abuse and Mental Health Services, SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Do not reproduce or distribute the presentation for a fee without specific written authorization from the MHTTC Network Coordinating Office. This presentation will be recorded and posted on our website. Okay. So now it's my honor to introduce you to our moderator today, Dr. Sandra Smith, PRS LC DCI, is the Peer Programs Manager for the Mental Health Resource of Texas, DBA via HOPE. Dr. Smith holds a Master of Science in Administration from Central Michigan University and a PhD in Human Services from Capella University with undergraduate studies in business admin. She is a published author with a book on her true life story choices. She is a reentry advocate based on her own lived experience with incarceration. And without further ado, I'm blessed to introduce this beautiful woman. Dr. Smith.
Good morning. Thank you so much for that. That was a very warm welcome, a great way to start our morning. I am super excited myself to be here and to be chosen and asked to be the moderator of this session. We're hoping to walk away from this session, as with all sessions, with tools and with some conversations that will hopefully entice some action and some advocacy. We have an awesome panel today, and we would like for them to take the opportunity to introduce themselves. Our conversation will be just that today. We want to just have a conversation. Again, we have panelists that are out there that are doing the work, and hopefully we can provide, again, some tools for you to be able to better navigate as peer specialists within this region for the individuals that have been formerly incarcerated. So let's just start with some introductions of our panelists. First, Bonnie Stribling from Arkansas. Bonnie, would you like to introduce yourself and just tell us a couple of things you'd like for our audience to know?
Good morning. Can you hear me okay?
Yes.
Okay, excellent. Thank you. So my name is Bonnie Stribling and my preferred pronouns are her and she. So I live here in Little Rock, Arkansas, and I am a peer recovery support specialist supervisor working right now at Natural State Recovery Centers. I previously worked at for the Department of Health in the Division of Youth Services. So I worked with our incarcerated youth here in Arkansas as a peer specialist, kind of building that program there, and it was a great experience. I also am interning with Faces and Voices of Recovery. So super grateful to be here, and thank you so much.
Thank you, Bonnie. Gary? Gary Mars is from New Mexico. Gary, can you give us a little bit about yourself that you would like for us to know? I think you're muted.
My name is Gary Mattis. I am from Albuquerque, New Mexico. I am a returning citizen myself. For the last 2.5, almost 3 years, I have been working with 2 different entities in helping men and women that are returning from incarceration. It's a very satisfying job, and I love to see success. It always makes you happy when you see success in the people you're working with. Thank you.
Absolutely. Thank you, Gary. And Dr. Zapata, Martha Isabel from Oklahoma.
Good morning. Thank you for having me today here. I am excited to be in the company of people who are working as peer recovery support specialists and doing programming to help our population. I am a Latina living in Oklahoma, and I am the director of the UMA Center, and we are an organization that develop and implement programming, particularly for Latino populations. We do programs in Spanish, and we support marginalized populations with education, workforce development, and advocacy as well.
Awesome. Thank you, Dr. Zapata. And last but not least, David Johnson, can you chime in and just introduce yourself to our audience? You're muted as well, David.
Thank you. Good morning, everyone. First off, I apologize for being mobile without a background. I'm driving, doing the dad thing, COVID. So my name is David Johnson. My pronouns are he, him, his. I was lead organizer for Texas Advocates for Justice as criminal justice organizer, grassroots leadership. I'm a former HOG fellow, peer policy fellow. I sit on the community strategy team for the School of Population Health at UT Del Med. And I am also a recovery peer and a reentry peer. I identify as a harm reductionist and an abolitionist, and I've been in successful long-term recovery from behavioral health issues for over 4 years.
Thank you, David. All right, we're gonna just jump right into it today. We got a lot that we want to discuss, and we want to hear from, again, our individuals that are there on the front line every day that are doing the work. This Punitive Justice and Community Health panel is put together really to discuss breaking down barriers of those oppressive systems keeping individuals from Black and Brown communities from accessing care, seeking, and that can promote wellness in the community. So what we're wanting to do is ensure that they are receiving the same level and type of care of the individuals, other individuals that are not of Black and Brown skin color. So when we're talking about individuals that are returning, we always start with what do they need? And so we're not going to have that conversation today because we have gone over that multiple times. You can Google that. People need ID, they need housing, they need food, they need transportation, they need a job, they need an education, they need all of the above. So got that out of the way. So now let's talk about how we can support those individuals. And I really wanted to start today's conversation with the panelists by simply asking, when you were invited to this panel and you heard the topic, Punitive Justice and Community Health Panel, what was your original thought and how do you think this can be helpful within our communities and within the work that you do every day? And we're going to just do this round robin. Maybe it comes from me being incarcerated, but I don't like for people to be very structured and tell me what I have to do and when I have to do it. So I'm going to just invite the panelists to just chime in again and have a conversation about what the title of this session actually means to you and how it might be of benefit to our audience. Gary?
I guess I'll start. Well, when I was in prison, an organization called Project Echo from the University of Mexico Health Department came to the prison and asked, was looking for people to participate in what they do, and that is teaching men about, well, at that time it was the men that I was working with, about health in the prison system, how to keep yourself healthy, teaching them about diseases. But their motto is prisoner health is community health. And so when I heard the title of this, I thought it just fit right in, because in my work, when I'm working with men and women coming out of incarceration, I really try to influence them in the direction of getting into the community. And it's not, sometimes when I say that to them, they think about the city of Albuquerque and it's huge, but I try to make them understand that finding a place that they can feel secure in and have people around them that are interested in their well-being is very important for their success in navigating through parole and probation.
Thank you,
I really
David.
believe in community.
Awesome.
Okay, so I can go next.
Sure.
Great. So initially, and I'm just going to say it completely honest, because this is where I'm at today. This morning, I had my coffee, so I'm going to do it. This morning, when I got a call to do this panel at first, initially, I'm going to be honest, I identify as a white female, and I thought this is not the panel for me. I thought maybe we needed to find, because I just did not feel like I was well equipped to handle this conversation. And then I asked more people and more mentors around me, and they discussed the idea of what it means to be an ally to communities. And so I really decided to kind of sit in that and understand that to its fullest extent. It would be ignorant of me to ignore the fact that I don't exactly have the same experience with people that are from a different background as me, just like with peer specialists and clinical team. And so I always sit down with people and recognize that I can't assume that I understand, right? And I have to understand that I am here to empower and facilitate a safe space to speak. And so that I thought would be an important conversation today for this panel, but also just the language is so important. So looking at punitive justice, I was like, why punitive? That sounds so negative, but that's the culture that we're in, unfortunately, right? And again, I can't ignore that. And I look at the systems that are in place and the systemic racism that happens, and I'm not going to ignore that. It's real. I did a study I'm at the Clinton School working on my master's of public service. Incredible opportunity recovery has given me. And in that, we explored the past 25 years, the state of Black Arkansas. And in that, we looked at incarceration, and it hasn't changed in 25 years. It has not changed. And in fact, now we're just bringing more awareness. So what are we going to do with that, right? And that's what I really enjoy about this opportunity to speak. And hopefully we can talk more about that later on. Thank you.
That is awesome and spot on, by the way, Bonnie. Thank you so much.
Absolutely. I want to jump in because, Bonnie, you saw you and I were playing that no, you go. So when this was first brought to me, I honestly thought, wow, I'm gonna go to the first meeting or so. Let's see how this turns out, because there's always the issue of cultural competency or the lack thereof when it comes to talking about health, especially when we talk about recovery, but we can really just get into health in general, because if we're gonna start breaking down silos, we need to stop differentiating types of health unless it's in a way to specifically name what's at play in that moment. It's all health, right? Just like it's all recovery. So to break down cultural competency in clear terms, I was like, okay, this is just going to be another bunch of lettered white people given space, authority, and agency to like put this together, who are going to then cull melanated folks in to give some integrity or some validity to this. In the day, it's a bunch of top-down thinking to echo by people who may not really have the cultural relevance to step in, right? And what I can say about this process is that while that absolutely presented itself in the very beginning, because systems, and we duplicate them because we lack creativity to imagine new ones and alternatives. But the minute the conversation started happening, and I remember very clearly, I sat back and I listened. I thought, I'm going to have to say something. And then something was said and it broke out. I was like, yeah, we need to look at this differently. And so I just wanted to extend that out and say, not only was I thinking negatively walking into it, but my experience has thus far changed my view altogether.
Yeah. Thank you, David. I appreciate that. Dr. Zapata, I think you're it. You're the last woman standing.
Thank you so much. Yes, I identify with David as well, because when I was called to this panel and I thought, well, I don't know what expertise do I have. I mean, I am a certified peer recovery support specialist, and I have not particularly worked with people who have been incarcerated or, you know, however, because I have worked with Latino populations for so long, and we have such high rates of incarceration, particularly among immigrants and people who come here without documentation. So then is when I saw, okay, that is where I fit, because I certainly have doing case management and behavioral rehab specialists work with these populations. And now through my agency, we are focused on training bilingual, bicultural, peer recovery support specialists who can serve our population, our immigrant population who is in jail or coming out of jail. And it's really a big challenge because we do not have enough people who are trained to do this. So to me, this panel is very important for the reason because I'm here to listen and learn best practices from the people who have been doing this for a long time and how I can apply this to Latino populations. And I can share with you guys all the challenges that Latino immigrants, particularly who are undocumented, go through when they are taken to jail, and oftentimes they end up being deported. Anyway, so there are so many issues. It's a very complex situation for them, and I will be happy later on to share with you guys about that.
Thank you. You know, whenever we say the words Black and Brown, whenever we start talking about diversity and inclusion, it immediately gets uncomfortable. The fact of the matter is there's no way to have comfortable conversations around race. There's no way to have comfortable conversations around diversity and inclusion and Black and Brown people and equity and all of the things that we need to be advocates for. And the truth, Bonnie, is that the youth and the white faces are the ones that are really going to be able to change this situation. And that's the real truth. And that, again, that's uncomfortable. But I applaud you for being here and speaking your truth and being a part of what inevitably the white community is going to have to come up with. The solutions, we've been providing the solutions for years. It is stop treating us less than. At some point, someone has to take that seriously. We're the minority here. We're the people, you know, that don't have the power. And that's really what the struggle is about, and other conversations that we can have around uncomfortable, you know, situations and topics. But let me move on, because I could get on that, go down a rabbit hole on that. But how do we move forward with meeting the needs? And let's just kind of tie this back into peers and peer support and peer specialists and the work that inevitably we do every day, and particularly what I do, which is provide training and certification training and support and CEUs to those individuals. What can we do? What do we need to include in our trainings? What types of support can we provide for the individuals as they are returning? And I also just want to say, oftentimes we talk about criminal justice system, the system. And I often ask people, what does that even mean? You know, I love asking questions because I really don't, sometimes I think about it. That is so massive and that is so huge. When you think about it in terms of the sequential intercept map, which literally goes through every touch point within the system, it starts with the community, it ends with the community. So really, when we talk about community and we talk about trying to properly reintegrate people, we really want to talk about quality of life and what can we do for those individuals when they're coming out of incarceration as peer specialists to give them a better quality of life. Who wants to take on that question? So I'm gonna, Gary, go ahead.
Well, in New Mexico, I work probably with every ethnic group there you can imagine. We have, you know, the Native American, we have the Black, we have the white. I got, you know, it's just amazing. And so you always have to be really culturally aware of where everybody's coming from, you know, because they all have different ideas. So I'll just give you a case in point. A woman had a voucher for a year for housing, and nobody could find her a house because she had like 4 kids with her, 1 kid in the hospital, and everybody kept trying to find her like a 3 or 4 bedroom house that was going to cost her like $1,500 a month, you know. And what's going to happen when the voucher runs out, because she only makes about $1,500 a month. She was Navajo from Farmington, and I had to tell people, I said, you know, she doesn't need a 4-bedroom house, because where she comes from, people live in very close-knit communities there. They're used to living in a large group of people and their family around them. And so being in a small space with a lot of people is not something that bothers them. And once we started looking at her housing situation that way, we found her a house within a week, you know, where she could live and be comfortable with her family. So everybody is so different. You always have to be so aware of where people are coming from and what they might be used to. It's not what we want for them, it's what they want, and it's what they need. And we forget that sometimes as peers, that it's all about that particular person. It's not about what we think they need.
Gary, thank you for mentioning that. I want to chime in, because that is certainly the case with Latino populations. For example, when Latino people are taken to jail, sometimes we don't realize that one of the most important things that we can do for them and help them with is communicating with family members. So this is so crucial, you know, just to be able to connect with family members. And here in Tulsa, we do have an organization that helps with that. They actually provide calling cards and this, and sometimes their family members are not even here in the United States. They are back in their country of origin, but just helping them communicate with their family members to let them know that they are alive, that they are here, that they are where they are. That by itself can do so much for the mental health of a Latino person. You know, because they are always concerned about their family. You know, they want to know that their family know that they are okay, you know, relatively okay, but at least that they are alive, that they are, you know, in a safe place or whatever. So whatever the situation is. So this is very important, like for Latino populations, and sometimes we forget about that. Yes, maybe we focus on other issues, but this is really, really important, and is cultural, really is cultural. Maybe other things are not important to them, but the family piece, the communication with family members is really essential.
I'll jump in right there. And I'll go kind of reverse. So Dr. Smith, you brought up, you know, the variety and definition from individual to individual regarding criminal justice system, right, or the system. So people will understand what I'm referring to as I speak. I think the use of, I feel like the use of any word before the word justice is really used in an attempt at divisiveness and in an attempt to proverbially turn a fist that can move people and things, or change the hand into just separated fingers, and to bring weakness into a movement that, if everyone recognized it truly affects each one of us, would be mind-blowing in its power and its impact. So I refer to the carceral state or the carceral system. And yes, as Dr. Smith laid out, it starts in the community and ends in the community. So it starts in the community, and it starts with the way our communities are policed, and the way that we as people in the community, all colors, all races, are programmed to believe that police equals safety, although all research shows that it doesn't. Or tough on crime, drug laws equals safety, although we know that isn't the case. And we know that isn't the case because enough white people started dying from trying to shoot grandma's oxy that it became an issue. And now all this research is being paid attention to, right? So we know that all these things, according to the data, do not work. And yet we continually like fall victim to cognitive dissonance and perpetuate this belief that, yeah, we have to do these things. And the only way for someone to become well is for them to go to a 30-day or 90-day inpatient treatment facility. And wellness only looks like absolute sobriety. And if you are in the community and you are using, then you're harmful. And if you have a behavioral health issue, it needs to be resolved this specific way or we don't validate it. And all that is part of that community, right? And the community hive mind that starts this carceral system. It is because of that that there is even a school to prison pipeline. It is because of that that you have a reentry issue. It is because of that that all these things are happening, right? And so when we talk about the criminal justice system or the juvenile justice system or the immigration justice system, whenever we often leave out the economic justice system and the education justice system and the food justice system. And all of those, if you take justice out of it and just replace it with wellness, you recognize that it is all part of this holistic spectrum of wellness. And when we allow the system, the carceral system, which is really just an offshoot of white supremacist culture, to be very clear, when we give into the system, we perpetuate it. And whenever anyone stands up and says, hey, here's a way that we can actually do this that doesn't perpetuate harm, that doesn't perpetuate punitivity, that doesn't perpetuate the very things we're trying to undo, you don't have quite as many voices speaking up. You don't have quite as many people showing up at the ledge, because who wants to drive to Austin if you don't live here? And if you live in Austin, who wants to go to the ledge? And so I'm naming all these things because in order to truly shift as a community, since that's where it begins and ends, how we as a whole, because if it hasn't affected us directly yet, it will. How we impact, how it affects us as a whole, right? That is completely up to us. That is completely up to us. We can go to the ledge and advocate. We can go to the city and the county and advocate. But you know what? No one wants to wait on hold to talk to city council people. Nobody wants to wait on hold to talk to the county commissioners. But everybody wants to complain about the lack of access to resources. And so that's where that's my soapbox for being an advocate and activist, right? And talking about allies. If you're white, talk to all the white people you know. Because melanated folks don't need white people telling them anything about what they're going through. We need white people talking to other white people. Because if you've been paying attention to the news, at the end of the day, white people, usually men, if not non-men who are trying to fall in line with men so they maintain their semblance of power, make all the decisions in this state. As a peer, what I feel like is my responsibility to do in order to make sure that the people I serve are most provided for, I have to keep my foot pretty close to the street. I have to remember very clearly what it's like to have problems finding housing. And as a formerly incarcerated person, I know that. But I experience a great deal of privilege because I've built up through chasing down homemade for rent signs with my wife, who has no criminal background, and so she can rent someplace just fine, right? I think it's staying connected to that need, staying connected to that to that hunger and that desire and that lack of access, so that when you say in Austin, if you send, or North Texas, if you say, hey, Foundation's community, but if you don't know the Foundation community caps you at 2 felony convictions, which I know because of my own lived experience being turned down, you might not know what to do if someone with more than 2 felony convictions in North Texas or Austin was like, I need housing. But it's up to that peer to say, hey, but I've been in touch, because this is all about relationship building. This is all about us living in relationship with one another. I feel it's my responsibility to make sure that I'm in relationship with apartment complexes that will do case-by-case basis, because that relationship that I have with them vouchsafes those that I refer. I think it's my responsibility to be in relationship with other organizations that are doing housing, so that if I don't know a way around it, they do. And the same goes for employment, and the same goes for medical care. Thank you.
Thank you, David. We can always depend on you to bring the heat, and it's much needed, and it's also 100% truth. Bonnie, you want to close us out on that question?
I do. Thank you so much. So 3 things I was thinking about, especially while the other panelists were speaking. One of the biggest things that I identify is being able to work with our advocacy groups that are in our community already existing. And so being knowledgeable of those and how to access those. So we have coalitions, we have nonprofits, we have just regular advocacy groups or task force, those have started to really, really grow in numbers. Unfortunately, or fortunately, Arkansas is a very red state. And so being able to have like some influence on some issues that may not be popular, it's going to really, we have to strengthen that and understand that. And so sometimes we have to reach outside of our comfort zone as a peer specialist and understand some of these larger things at play if we want to get involved with that. If we don't, then the next step is really to focus on my network. And that something in Arkansas that's incredible is our network. Like we have social media, we have a webpage like arpeers.org. We have a lot of ways to connect with each other so that we can get the most personalized, useful resources for our peers that we serve. And we have reentry organizations, and we have peers at those locations. We have peers in the jails. We have peers in all these, and then we also have them at the providers. We have them at the offices that they need to go to. And so really being able to collect and bridge that gap, right? That's going to be one of our biggest parts, and knowing my community that I live in. And if I don't know, then I'm going to know someone that does. And so being able to know within myself, I can't reach this, but I know somebody that can, and being able to build that relationship with those people. And the last thing is rural parts of the state. I cannot stress how important it is for us to organize in those areas. We have the Delta, which is incredibly, we need more resources is going to be the best way to put it. And just like what was said before, it's going to take a lot of organizing and being able to fix or to work on that. But we really struggle in that area, and so I hope to see change for that in Arkansas.
Dr. Smith is muted. There is something I would like to add, if it's okay. And also, no one wants dead air, so I want to say this. Also, look. Most people enter the world of recovery through the 12 steps. And I'm going to say this so everyone is, I participate in 12-step modality. I do. And I am fully aware the 12 steps is a book written by white people at a time when black people and white people weren't allowed to socialize together. It was written in the middle of Jim Crow. Read it, even when you read the newer editions, it's still misogynistic as hell. Right? It's genderist, it's elitist, it's classist, it lacks cultural competency. And yet if I say this, people get super defensive. Oh, but I get it. It is what guided you away from the crack pipe or the bottle or the meth rig or whatever. It guided you away, right? But I think very often people lock their growth and their own wellness into that modality. And as a result, when they have to engage with people outside of the scope of their own individual recovery, it creates an obstacle. And I've been through training with people who have said, oh, you know what? Yeah, I go to AA and I go to 12 steps, but I'm open to all this. But when you see them put it into operation, you actually see many struggle with being able to act as a peer, because through this training, through 12 steps, they are operating like, I'm supposed to be a sponsor, I'm supposed to do this. And that in and of itself outlines the issue. One of the issues with that falls into peer support is that I think to move forward peer support, part of it needs to be a full awareness of the variety of options in the recovery spectrum with regard to treatment modality or response modality. And, locally, the Texas Harm Reduction Alliance put out a job posting for an outreach worker / peer support specialist. That is the kind of stuff we need to see. We want to talk about peer support specialists moving forward. We really need to see a further investment in RCOs, but also an expansion of the presence of peer support specialists in the areas that they have not always occupied, and in areas that many of those with the certification don't necessarily feel comfortable. It's time to stretch those growth edges.
Thank you for taking advantage of me being muted. I was so busy looking at the chat box that I accidentally muted myself. So let's talk about some successes. Let's change the tone just a little bit, and because as I mentioned when we started, we really want to talk about tools, and we want to be able to share. And as a region, I think it's really important for us to know that we're all doing things different, right? We have to all figure out the way to make things work for us and the populations that we're serving. So the next question I want to put out to the panelists is give us some examples of successes Again, I think we could really beat the horse about all of the things that we know aren't working properly. And we're going to continue to advocate. And we really, really, really appreciate all of our advocates out there. We all need to be advocates as peer specialists. Everybody has, I think, chosen a lane, and that is how we actually go and we flourish when we focus and we find particular, again, going back to the whole sequential intercept mapping model is huge. Today, we're talking about reentry, that specific area of the model. So I would like, we have a really great cross section of Region 6. So I'd like for you guys to share with us some of the successes that you've seen towards reentry peer support, towards community health, any types of tools and support resources that you can share with us around getting people to that place of what I call just quality of life. I go back to that. That was something that was shared to me early on when I was introduced to recovery and this whole idea of peer support. So yeah, if you guys can share with us some successes and some of the things that we can share and take away from this conversation that might benefit other areas within the region.
I'll chime in. I told you earlier, I work for two different agencies in peer support with returning citizens. One's Best Chance, it's a nonprofit. But when I was in prison, I was telling you about Project Echo from the University of Mexico Hospital that came into the prison system, and we were being trained as peer educators. Well, now back in October of last year, they called me and about 6 other peer support workers, and they started a new program. And what we're doing is we're working directly with probation and parole, the state of New Mexico, which I was thinking, man, this isn't going to work. But anyway, we work directly now with the probation department of New Mexico. They send us their probation officers throughout the state. We're trained through Project Echo. They send us referrals every day throughout the state. I work with people in Farmington. I work with people in Clovis. I work with clients on the phone every day from all parts of the state. And like last week, we went through an end of year training, and the head of the probation and parole department in Mexico was there. The Secretary of Corrections was there. They all went to the training with us. And so, although there's still this kind of like, this maneuvering, it is working, and it's pretty interesting to get their perspective. It's interesting for them to get our perspective, and so it seems to be working really well, and I hope it just grows. And they're thinking of taking the program into different states, to see if they can get that going in different states. But at least it's a start, because we're dealing with an entity that hasn't changed in 80 years. It's just very rigid, but they're open and they're working with us. And so I'm really enjoying my experience with that.
Thank you, Gary. Bonnie, I saw you unmute. Are you ready?
Yes. Awesome. Thank you. And Gary, you have inspired me. You didn't even maybe know that you did, because in our previous practices of the panel, you had a lot to say about your state and your programs that you're working with. And I was like, I need to get in the know of what's going on in Arkansas. So I started doing some research, but some cool things. 2 things I'm going to mention is 100 families. And this is a coalition. And there's some people on this call actually that are involved with it. And it's a reentry and also works with our foster care system. I guess it was Asa Hutchinson, who's our governor. It was an initiative, but he worked with Restore Hope, which is a reentry organization, and really getting into our communities about what do we need for our reentering population. And so that has been, they're using peer specialists. They're using people with lived experience. I'm really excited to see what happens. And then also the Division of Youth Services, people that are serving time for crimes they've committed under the age of 21, they went through a big transformation, and they stopped focusing on punishing these youth, and now they're doing treatment. And that has been a really big, for me, it's been a really inspiring change. But then they also started diversion programs. And so we also have some organizations for them to go into before they get into DYS. And so I've been able to work with those groups as well and do peer support there. And I think that working with our youth and working with especially like our communities and our neighborhoods and really creating alternate routes obviously is going to be great. And so Arkansas, I think, has been working on that. And there are some great laws that have been passed in regards to fines and fees, and then also our driver's license, putting a restriction on those and being able to get your driver's license back. That was just passed this year. And once your record is expunged, you can get your driver's license back. And then also well, anyway, I'll stop there. I'm very excited about what's going on in Arkansas.
No, it's fine. That's what we want to hear. And we really love, again, sharing those. I think we'll have an opportunity to email each other. I think our email addresses for the panel have been put out there. If not, we can make sure that happens. And so, Gary, did I see a hand, or Dr. Zapata, which either way?
Thank you. Yes, I want to say something. I just cannot overemphasize the importance of connecting and bringing on board community-based organizations that work particularly with the type of populations that we want to serve. Because we usually are not culturally competent, in cultures that are outside of our own, cultures in which we did not grow up, and that applies to me. I worked primarily with Latinos because that is what I know best. So it's really, really very important as peer recovery support specialists trying to help our clients to connect with those community-based organizations. I feel that it's our job and our responsibility to connect with those organizations, to reach out to those organizations. They exist in every city, sometimes that we don't know, we are not aware of them. And it takes a little bit of detective work to find those organizations. They don't advertise. Oftentimes it's your word of mouth. So talk to your clients and find out which organizations, and have those organizations handy. And something I learned as a case manager years ago is that a personal connection with those organizations is very important in order to effectively help your clients. For example, it's very different to say one of my clients, go to the Salvation Army that they can help you with this or that, or go to this other organization. Here is the phone number, just call them. That is very different than me having, a personal relationship with somebody within the Salvation Army, as an example, and say, hey, maybe even calling that person there and say, hey, I have a client, when can you see them, or would you be able to provide this or that for them? That makes a whole lot of difference, and it's also bringing down those barriers that prevent our clients from getting the services that they need. So in my experience with particularly Latino populations, I know that as case managers, as peer recovery support specialists, we have oftentimes to work extra hard because our clients need a little bit more than clients from ethnic groups that are mainstream, like Caucasian people. Like Latinos, they have language barriers, cultural barriers, documentation barriers. So it requires a lot more work for us to help those clients oftentimes. So this is why this work is basically a hard-based work. Yes, I mean, it has to be really something that we are passionate about. And I know that peer recovery support specialists are very passionate about what we do. So I really invite you guys to always have those organizations handy, build relationship with them if you really want to help your clientele. You don't have to know, every culture in town, because there are so many other cultures. I don't know anything about Burmese culture, for example, and we have a Burmese population here in Tulsa. But it's my responsibility to connect with the people can, partner with them to help my clients. So I think that is very important, because oftentimes what we say is, well, I don't know about any organization that serve people, from this or that ethnicity. It's kind of very easy for us to say, well, I really don't know about that. And so my invitation today is just to kind of go the extra mile and make those connections, hopefully one-on-one, so that we can serve our clients better. Thank you.
Awesome. Thank you, Dr. Zapata. I think, David, you're the only one left. Share examples of successes in your state. I just wanted, before you answer that, David, I just wanted to chime in on or tag on to what Dr. Zapata, I think Dr. Zapata, Gary, and Bonnie have all said. And that is, you know, just like there are multiple pathways to recovery, and we should support all of those, there are multiple pathways to successfully reenter into society. And we really, as peer support, should focus on not how we think it should be done, but what is the best path for that peer. And we need to be able to have the conversations with the peer. There are so many times that, you know, people just don't ask. We don't know because we don't ask. We just assume, and we all know what assuming gets us. So what we really should be focusing on when it comes to peer support, particularly, I think for all the populations, but particularly for this is, what is your plan? What are you gonna do? I'm just here to support you. I am here to have, you know, resources, and it is our responsibility to have updated resources, not having them all over the place, as Dr. Zapata stated, not giving them outdated resources, which is going to create more frustration for them, which will ultimately lead them to go back to what they know, which will ultimately lead them to recidivate, which is ultimately what we're trying to reduce here. But as peer specialists, it's really just allowing them the opportunity, sometimes for the first time in their life, to look at their life, to look at their future, and to say, what is it I want? What do I want to do? Nobody's ever asked that. It happens all the time with young people. Nobody stops to ask. People are constantly telling them, this is what you should do. This is how you should do a thing. But what does your opinion matter to me as an individual? It's just your opinion. What we really want to get at is, what is your plan for your life to have a quality of life and not to return to that place that no human being, I feel, that's just my personal opinion and nobody asked me, but I don't believe that people were created to be behind cages. And again, that's a whole nother session, probably a whole nother conference in and of itself. But I'll get off that. And David, again, can you share any examples of successes that you know of in the state of Texas when it comes to supporting individuals that are re-entering into society from incarceration?
Yes, I do. So thank you for asking that. I mean, locally in Austin, there a couple of years ago passed the fair chance hiring ordinance, which restricts most employers with a staff over, I believe, 50. And I say most because there are some exceptions for like government posts and posts like. But there is question about someone's previous justice involvement allowed to fill until the employer is ready to make an offer of employment. So that's a wonderful advance in the area of reentry to bring a little bit of long needed equity, just a sliver of it, but a long needed equity to the employment justice movement, especially with regard to reentry. Also, like locally, organization wise, I would love to name Communities for Recovery, which is an RCO in Austin. And one of the things that they've done is create meetings, modality and non-specific recovery meetings, but it's the recovery from reentry. And I'm all about naming those that do the work that I'm proud of. So like Javi Soto and Chelsea Biggerstaff at Communities for Recovery, amazing work. But there's a jail meeting, and I've attended it, where you get to sit with other individuals who are not only trying not to get high, but are trying to figure out housing, or trying to find jobs, or trying to get their Social Security card, things like that. And also, I'll name something at a ledge level. You know,
Okay, David froze. So if he unfreezes and chimes back in, then oops.
To
a second, David.
Okay, I'm sorry. to allow, so the second look bill, the goal was to both cap parole for those who were convicted as juveniles under like, but were what do you call it, enhanced as adults, or certified as adults, and also to require a review of any convicted juvenile sentence once they've spent 20 years in prison, to prevent their entire life from going down the drain. And I named this as a win because it passed the House and the Senate in Texas, and it was only because of the governor that it was vetoed. And so when talking about ledge activism and advocacy, if you are only measuring wins in whether or not a bill gets passed, it's a horrible metric, because so many years of work in the background that a lot of people don't see if they're not sitting in on those Department of Health and Human Services hearings and things like that. There's a lot of movement that goes over several years to make things happen that affect us locally. And Dr. Smith, I know you know with regard to certification standards for peer recovery, or peer support. That is a perfect example, but Medicare, Medicaid, perfect example. But there are a number of things that take years to unfold at the ledge that directly impact us. So the fact that passed both chambers of the ledge is a win, because that tells us we are one movement of power away from having that passed.
Awesome. That's a great segue into the next question, David. So can any of the other panelists from different states chime in on any new legislation, not necessarily the most recent legislative session, but any legislation from your state that you'd like to share? Again, we've got over 216 people, which is awesome, on this session. And we really want to be able to give folk some things to go back and research, go back and use. We want this session to be something that is positive and some things to take away. So any other states want to chime in on some recent legislation around the topic of reentry or peer support for that matter? Gary?
In the state of New Mexico, unfortunately, it's tabled right now, but at least it hasn't been defeated. They're trying to cut down on the amount of infractions that people can be sent back to prison for violating. In other words, drug use, dirty UAs, just things, simple things that parole officers would use to send people back to prison. So that's being tabled right now, but at least it's still active. And I think that would be awesome if they can get that passed, so that would cut down on the amount of people going back. It has been done in Albuquerque. In New Mexico, though, they are a lot looser. I think the COVID kind of changed things a little bit, and they were releasing more people than they were sending back, which was good. But I hope that gets through, because, people, they violate, everybody's going to have a moment in their recovery where they make a mistake. And so it's really sad for people to get sent back to prison because of that. So I think they're trying to amend that in the state, and I hope it goes through.
Awesome. Thank you, Gary. Bonnie?
Yes. So I didn't know how to get involved as a peer specialist with this conversation at first, when I first started. And so it took some guidance. Basically, what I needed to look up was my local coalitions. So I found some reentry coalitions, and we have a peer coalition starting. And then we also have some collegiate recovery. We also have, so finding our, and sometimes they're written in the grants that we get from SAMHSA that we have to have coalitions. And so really, as a peer specialist, what's going on in my state, that's what I can do. I can go directly to these coalitions, and that's going to be made up of people that are not peer specialists. Sometimes they may work at the housing office, the housing authority. They may work as a lawyer, and they're trying to do some pro bono work. They may work, so, or transportation. I got to hear a presentation from our bus system and what they're doing. So really, that's how I can get involved as a peer specialist, learning about some of this stuff. So I will say, because I got involved with our reentry coalition, I'm going to put in the chat the names of these bills. It's crazy. It's just so cool that we have some. before I was like, I don't think I have anything to say about it, but now we do. One thing I'm excited about is provides a second chance for 60,000 citizens who have paid their debt to society by sealing their nonviolent charges. And that was HB 1256, and that was passed. So I'm super excited about that. And then also restrictions on solitary confinement for women that are pregnant, and especially under 16. I think what they're working on is protecting them, the vulnerable populations. So solitary confinements that have been passed. We don't even really hear about that, but that affects us in our communities and recovery. So anyway, I'm gonna put those in the chat. Thank you.
Absolutely. Thank you so much, Bonnie. And I'm so excited that you found your way to make sure that you were included in this conversation, because it's so important. Anybody else? Dr. Zapata, do you have anything to add on that, or? Nope. Okay.
No, I don't, because I think the resources are local.
Mm-hmm.
And quite frankly, here in Tulsa, Oklahoma, we are a kind of new immigrant destination. It's a new, like last 20, 25 years. We are very different than states like Texas, like California, New Mexico, where Latinos have lived from generations. They have lived there oftentimes before the United States was a country. So we in Oklahoma are kind of a little bit different. And what I have learned in these 20 years working with mental health is that we generally are behind states like Texas and California. So when I get to talk to clients from those big states, those traditional Latino enclaves, they always tell me the same. I'm surprised that we don't have almost anything in here. It's like, oh my gosh, in California, we have this and that and that and that. And so we are kind of always behind. We are always learning from you guys. So my agency and myself, we are hoping to change that and catch up a little bit. So that's why I don't have kind of a list of resources or initiatives. I am working with the Oklahoma Department of Mental Health, though, and Tony Stelter might be here. And so we are working precisely, to create an initiative that will support the recruitment, the training, the placement, and the support of bilingual and bicultural peer recovery support specialists in mental health agencies across Oklahoma. So we are working on that. That is something that's totally new. And so we are working toward those goals. And hopefully in the next event that we have for this nation, we'll be able, Tony and I will be able to share more with you guys, our progress. Awesome. And maybe best practices as well.
Absolutely. Thank you. I appreciate that. David, is there anything else you wanted to add along the lines of recent legislative? I think you shared a couple with us there. No, David's not.
No, I'm good.
Oh, okay. Oh, wait, can I just, we're getting at the top of the hour. So if you guys have specific questions, I think a couple have been put in the Q&A, and then we have Jennifer's there answering. But if you have specific questions that you would like to put out to the panel in this last moment, if you could add those in the Q&A, we'll take a look at those. I'm sorry, go ahead, David.
Oh, no, I I was going to say legislatively, like this session, it was just horrible.
Yeah, it was. Yeah, yeah, I know.
We're licking wounds and trying to and doing counts of what were, like when you have what are the 20 worst bills that passed this session, it was what kind of show it was.
Yeah. And I think I appreciate those that are actually adding into the chat box some links to some legislative acts. And, I would not, want everyone to become legislative experts, but I do think it's really important in order for us to support our peers to be at least familiar with what is going on legally. I mean, some of those bills can pass and actually be things related to our peers that can help them. And as part of our advocacy, I think it's really important that we're able to be at least informed And there are actually sites that you can go to that can kind of break through all of the legalese and really kind of list them for you in category by legislators that are supporting them. So thank you all for that. And our last question before we go into the Q&A is really just about, as peers, what is our responsibility to those that we're working with when individuals get out of jail, prison, and again, for me, a loss of ability to be able to be in society is kind of not the same, but it's on the same wavelength. So what is our responsibility as peer specialists to be able to do to help those when they get out? And I think we've touched on that a little bit, but I'd like for us to end our conversation being a little bit specific about what we can do as peer specialists and as supporters and allies and advocates of those that have been incarcerated once they are returning citizens.
Well, I guess my first thing is I tried to make them understand that they're not alone, that they're not, that they have support out there, that people are willing to help them, and they're not to be afraid to ask for that help. I know the first time I got out of prison, I didn't ask for help. I thought I could do it on my own. The second time I got out, I had a whole different outlook on it. So I just try to make men and women understand that there's people out there that want to help them. All of society